as you know, when you're dealing with seniors and health issues, especially those that may have dementia, those that are in need of some type of assistance, it's a maze. There's so much to go through and deal with, and Truth for Seniors exists to give you the most up-to-date and accurate information. So we're all about information and education, and hopefully we will help you save time, efforts, stress, and money by getting your information straight from the source. So we are made a commitment to you to bring you experts, people that have been vetted, people that we have done the research, we've looked and made sure that they are truly experts in their field, and we bring them to you so that you get the right information at the right time, and you can also follow up with them and chat with them on your own. So today, I'm very, very pleased to have on the show Dr. Bhatia, who is with the Neuro-Pain Medical Center. Welcome to the show.
Thank you.
We've been looking forward to this for quite some time. And before we get into, what I know we want to talk about, which is your clinical trials, I wanted to share a few statistics that you provided that are amazing, and I'm sure people in the audience maybe know some of this, some they don't, but Alzheimer's today is the 6th leading cause of death in the United States. There's 16.1 million Americans who provide unpaid care for people with Alzheimer's or other forms of dementia. Those caregivers provide, get this, over 18 billion, that's with a B, hours.
Yep.
And that's a value of over $230 billion. I mean, that's amazing. Yes. One thing that really impressed me was, we talked about this, between 2000 and 2015, the deaths attributed to heart disease decreased by 11%.
Yes.
But the deaths from Alzheimer's increased a whopping 123%. That's unbelievable, and yet I do believe it because I see it. And so currently 1 in 3 seniors dies with Alzheimer's or some form of dementia. It kills more than breast cancer and prostate cancer combined. That's amazing. So currently today they estimate 5.7 million Americans are living with Alzheimer's. By 2050, this is projected to rise to nearly 14 million, so darn near 3 times what it is today. And you shared with me every 66 seconds.
Yes, that's the latest statistics. Every 66 seconds, there is a person diagnosed with Alzheimer's disease.
That's amazing.
In the U.S.
That's amazing. Okay,
yes.
In the U.S. Wow. Well, I am very, very happy that you were able to take the time. I know you're incredibly busy to share this because it's something that everybody realizes as we get older we're going to have to deal with.
Yes. And I will say everybody lives till 100, they're going to get dementia.
Really?
Yes. Rarely you will find somebody who does not, but most will.
So let's talk about that real quick because we are living longer. That's been proven for, a few decades now. But what are the main factors for dementia?
Dementia, by definition, is progressive loss of memory in different domains. Some people have learning memory, visual memory, but mainly it's the memory.
Okay.
So like any trial we're doing or anything, they just want 6 months, history of 6 months progressive loss of memory.
Okay.
They don't have to be diagnosed with any type of dementia. So by definition, dementia is progressive loss of memory or progressive loss of different domains like cognition, talking, thinking, executive functions, and all those. So that is by definition dementia.
Okay.
Now, if somebody has a fever, the fever can be many reasons. Like they can be sore throat, they can be having pneumonia, UTI. Same way, dementia is a broad term. And dementia has, again, further many reasons, or you can say many causes. And 80% dementia is Alzheimer type.
Really?
Okay, so there is 80%. So there is degeneration in the brain. The amyloid plaques are formed, neurofibrillary tangles are formed. So slowly the cells keep on dying. We still don't know why. Then rest of the 20%, you can say another 10% will have vascular dementia. As we were discussing, multiple strokes in the brain. They keep on killing the brain cells and then can cause dementia. Another one is Parkinson-related dementia and Lewy body dementia. Then come the rare ones, like somebody has a frontal lobe dementia or a Pick's disease, and then rarely mad cow disease and all those viral infections, but very rare.
Okay. So also, I think one of the things that people are always wondering is there a difference between Alzheimer's and dementia? And if so, what is it? How do we know what that difference is?
So Alzheimer is a type of dementia. So there is no, if people say that I have dementia, depending on the cause, Alzheimer is one type of dementia.
Okay.
So you can, as I said, dementia is a broad term and Alzheimer is more specific. Mm-hmm. The only rarely senile dementia mostly happens in 90 plus people, and then there is different testing done to differentiate between what type of dementia they have. The medicines available so far are only for Alzheimer dementia, and there is one medicine approved for Parkinson-related dementia. Okay. Now you need to understand in this country or any country, any medicine before it is approved by FDA is tried and on clinical trials on a particular condition, and then FDA approves for only that condition, though that medicine may be used for many other reasons.
Okay.
But again, then they are labeled that this medicine is approved for Alzheimer dementia.
Okay.
So till so far, the only way to confirm Alzheimer was one by after autopsy. So they will take a piece of the brain, take the piece of the brain, look under microscope, you got any of these two, either amyloid plaques or neurofibrillary tangles, you got Alzheimer dementia. Mm-hmm. But then few years back, I think 10, 12 years back, they started finding the tracers, the proteins, which are increased in an Alzheimer person. So the only way to get those were to do a spinal tap. So many times, if we are in doubt, we don't know what to do, we can do a spinal tap to confirm the diagnosis, and this is proteins are seen increased.
Really?
But then many times, patient will say, I don't want a spinal tap, because then you still end up giving them that medicine, right, which is available.
Sure.
So why not give them as a tentative diagnosis of Alzheimer, or what we call as a probable diagnosis of Alzheimer.
Okay.
So everybody was getting that medicine unless we were sure that, okay, this person had multiple strokes, I think this is vascular dementia, or this person also has Parkinson's, I think this is Parkinson-related dementia.
Okay.
So then we were not giving those medicines.
So, and we're going to take a break here in just a second, but one of the things that people hear all the time is that it's, I just lost the word, that, you inherit that it's genetic.
No, it is not. There are very few dementias which are genetic.
Okay.
And not commonly. You can find, like Parkinson, you find more people of Parkinson's in the same family, same way as MS. You can find more people, siblings can have MS, but it is not hereditary. There are very few genes which are hereditary. Not common person will have
So my father was diagnosed a couple years ago with Parkinson's. He's had some strokes. He's also diagnosed with dementia. I'm 57. Is it something that I should be concerned about because it's genetic, or it's not genetic?
No, it's not genetic.
Okay.
Genetic, when we know that we can test your genes, but again, there are some rare familial genetics present. Okay. Now, I want you to understand and know that the rate of Parkinson's is much higher in the Central Valley than other areas of U.S.
Really?
Yes.
Oh, man, you threw me one here, so okay.
Because
if we can, real quick, hold that thought. We're going to take a quick break. This is interesting. So why is the Central Valley higher in that? We're going to hear right after the break. So we're back with Truth for Seniors and Dr. Bhatia with Neuro-Pain Medical Center here in Fresno, California. So we were just discussing Parkinson's, and you dropped a little bomb on me right before the break and mentioned that in the Central Valley of California, Parkinson's is diagnosed quite a bit more. It's more prevalent. And the reason for that?
UCLA did a study. It was called as PEG study, PEG, PEG study.
Okay.
So they, whosoever had they contacted the neurologists to see if they can get a list of the Parkinson patient. They sent them survey, and survey they also evaluated them. Not only survey, they evaluated them also, and found out that Central Valley has a higher rate of Parkinson just because of pesticides.
Really?
Pesticides in the water, pesticides in the fruit, so in the wells, so there is higher.
You can't get away from them.
And you can't get away from them.
Yeah. So even the soil, I mean, it's so nutrient poor anymore, but it's still got the residuals, I'm sure, of pesticides and anything that's grown.
Yeah.
In fact, I heard recently that not even all of the organic stuff is pesticide free. There's different
There are
things.
different things they do.
Yeah, there's
They're
different grades,
supposed to be,
I guess.
as far as I know, they're supposed to be pesticide free, but I don't know.
Wow. So, isn't it amazing? It's kind of a little side thought, but isn't it amazing how we'll invest in, cars, and we'll invest in, hobbies, and we'll invest in other things that give us pleasure, but we don't seem to do as a group very well in investing in our health.
I agree with you.
And it's sad, but I mean, you go somewhere to eat organic, to grow organic, and to do the right thing, and it does cost a lot more.
Yes.
But people are a little bit unwilling to do that. So now you've been practicing here in the Central Valley for how long?
18 years.
18 years, okay. And I know right now you mentioned off air that you will see, several people every week that are new prospects for some of the clinical trials that you do. But let's talk about those trials a little bit, because I know that you've seen incredible success. And so maybe you can kind of just take some time and share with us.
So what is a clinical trial? In USA, any medicine which has to go to FDA for approval has to go through clinical trial, except unless they are sold over the counter. So any prescription medicine has to go for clinical trial. So let's say, and just for your information, in the last 10 years, there has been no medicine approved for Alzheimer. The last medicine approved for Alzheimer was 10 years ago.
Really?
There are many new medicine came out for epilepsy, much better control, same way for multiple sclerosis, MS, nothing much for Parkinson's, nothing much for Alzheimer.
Okay.
The disease, Alzheimer disease, if you want to say, is complicated and progressive. And still we don't know what is causing it. So, as I said before, the two hallmarks for Alzheimer are amyloid plaques and neurofibrillary tangles.
Okay.
So now, with the special scans which are available, we see that they're present. And again, the studies have shown that people start forming these plaques and tangles even at 50 years age, or even earlier.
Really?
But they do not cause a memory impairment till they are significantly increased in the brain.
Okay.
So when we do a scan now, these special scans which I'm talking about, these are what we call as a diagnostics of the Alzheimer disease. Now, so far these are available only by the clinical trials.
Okay.
If somebody want to pay, yes, they can get it done, but it costs about $5,000.
Oh, wow.
And interestingly, what happened that 2 years ago, Medicare said, and they came up with and their main author was from UCSF, Dr. Gale, came up that, okay, let's do a scan on anybody who has any type of dementia. The only thing was Medicare was paying for it. So they have to have a Medicare 65 plus
65
and a dementia. Okay, so we did these. They had about 18,000 patients in the whole of US and Europe, I think mostly US, doing the scans.
Okay.
So only criteria was we check them dementia, we check their numbers, what medicine they are on, and they go and get the special scan, and they come back. And interesting findings is, one, if patient does not has Alzheimer, they have like what we call as a mild cognitive impairment. They have not gone to a level of dementia yet. Okay. 50% people who we were thinking that they are going to develop Alzheimer, the scans were negative. They had some other issues and not Alzheimer's.
Okay.
And anybody who was diagnosed with Alzheimer's and dementia, the 30% patient scan was negative. They had something else going on. So Medicare reason was, okay, we want to see how it changes the care. If somebody has a confirmed Alzheimer's and goes to the hospital, how they are being treated. Somebody is on medicine, how they're being treated. So Medicare did that study. And they are probably going to come back with a second study and larger study. Now they want to go more into diversity, because in the previous, this study, almost 80% patients were white Caucasians. So now they want to go into, okay, can we get Hispanics?
Sure.
Can we get Orientals?
Sure.
Can we get Afro-Americans to participate in the study?
Really?
And they may be coming probably, I will say, mid next year.
And on that note, I happen to see a little thought here. older African Americans are about twice as likely to have Alzheimer's or other dementias as older whites. Is that something you've experienced or you've seen?
Depending, I have seen, again, in the Central Valley, you still know that we mostly we see are Caucasians, then
Sure.
the Afro-Americans are not in a high number as compared to Caucasians.
Probably more
Hispanics, more
yeah.
Hispanics, okay? So whatever we see, yes, but can I say they are, by the statistics, I agree with that,
Sure.
okay? But I don't see so many. But I do see some young people also who are Afro-American and have dementia.
Really? Wow. You're talking young, like 45, 50,
I would say
55?
for dementia type, 55, 60 is young.
Okay, okay.
Yeah.
And it used to be that we knew that people, say if they're diagnosed today, it was probably a good chance they had the disease for maybe 6 to 8 years, maybe 10 years now is what they're saying?
Pathologically, by the scan wise, they have a disease even from 10, 15 years. Okay, but and it is also seen when they are thinking of memory impairment or when they are being brought to a doctor, they're already between mild and moderate stage. We don't see somebody who is really, really mild. Rarely we'll get somebody, but already they're mild to moderate stage. Now, just giving you example and how we characterize, we do a test called as mini mental state examination. Okay, and that is the most common test being used for the clinical trials, for diagnosis, and also for office. So normal score is 0 to 30.
Okay.
Okay, from 30 to 27, we call it MCI, mild cognitive impairment. From 26 to 21 is mild dementia or mild.
Okay.
From 20 to 11 is moderate dementia, and below 10 is severe dementia.
Okay.
So I know you were asking at sitting outside, what benefit they get. Again, the earlier they are diagnosed, the earlier they can start the treatment, we can so far slow the progression of the disease. We cannot do anything different.
Sure.
Second, if somebody is diagnosed till certain level, I will let them drive. After that, they become risk. So it is important, and they need to understand, please put the car keys away.
Mm-hmm.
And
Yeah.
third is financial for planning. Okay, now I have been diagnosed, I need to make a will or whatever they want to do from the financial planning. Now, same way preventative, we can, again, your resources, Valley Caregiver, other people's resources can help in having them stay at home. They need
Sure.
a care home, they need assisted living from there so that they don't fall, they are not at risk of injuring themselves.
Yeah.
So
Yeah.
that's why they need to have a diagnosis and prognosis looking into what they can do, what they cannot do.
Makes a lot of sense. There's a statement here on some of the notes that I was looking at. It says Alzheimer's is the only disease of the top 10 that cannot be prevented, cured, or even slowed, but I think we're seeing now that it can be slowed with an early diagnosis and early treatment, right?
Definitely. This is again, these medicines which are available, some of them are approved, so you can say the FDA approved them, so mild dementia, other one is for moderate dementia, okay? And some people think this doesn't work in mild dementia, has to go to moderate dementia to use it. If something is going to work in moderate dementia, why it will not work in mild dementia? It is only a flaw in the study, how they did the study, okay? So nowadays, the studies are getting more and more tougher, okay? We have to do more different type of memory testing. And not only that, to make sure that everybody is doing the same way, and that's where one of the flaws was in the past. Center X will do a different way, Center Y will do a different way, Center Z will do a different way, they're testing. Now everybody's same. And not only that, we are recording, and we are video recording. And there is a central person who is given a responsibility of a big company that you need to watch each one's recording and make changes so that everybody is doing the same way.
Really?
Yes.
Wow.
So
wow.
these clinical trials are getting more and more tougher and not only simple, because they want a outcome, not as that, okay, we flawed this study because everyone was not doing the same way and not scoring the testing the same way.
Well, I could see why they would want that. I mean, they're putting, millions and millions and millions of dollars into these things, hoping that they'll get a return someday.
Yes.
So, all right, we're going to take a quick break, and I want to come back and and specifically maybe get into some of the trials that you're doing. Folks, we're talking here with Dr. Bhatia, who's with the Neuro-Pain Medical Center. Definitely an expert in the area of Alzheimer's and dementia, and he's got some trials that he's doing that he's going to share with us after the break, and something that you really want to be aware of, because all of us know that we're going to get older, we're going to have a really high potential of dealing with these diseases, whether it's with ourselves or spouse, elderly parents as well. And one thing I see is that so many people wait so long in the process that even if they get a drug, it kind of is iffy if it's even going to help them or not. Yes. So we'll be right back with Truth for Seniors. Hey, we're back with Truth for Seniors and Dr. Bhatia with the Neuro-Pain Medical Center, talking about Alzheimer's, dementia treatments and clinical trials. So real quick, before we get into the clinical trials, my wife's grandmother, bless her heart, was in her 90s, lived in Kansas, did everything herself, still mowing her lawn, ornery as could be, and healthy, so we thought, and decided that she needs to up and move and be cared for. She's getting a little up in age and needs to be cared for in Washington by her daughter. So they move her, and almost instantly they notice that she's got memory loss and she's fumbling around and her balance isn't as good, but mainly memory loss. And then she got really agitated. And of course, having to move, they didn't have a primary care doctor for her right away, and thought, well, maybe the impact of the move is that final straw, and it just kind of sent her over the edge. But after a few months, they actually got her into a doctor, got a complete evaluation, found that she had a UTI of all things, and literally within another 4 weeks was back to being mom that everybody knew and loved, still in the moment, still able, no memory loss. That blew me away. I had no idea that could be an issue.
You need to understand one thing, that anybody who has a less brain reserve, either due to strokes or MS or any other reason, somebody who is developmentally delayed, Down syndrome, any type of infection, either urinary tract infection or pneumonia, can just put them over the edge into more worse. Agitation, more memory impairment, hallucinations, behavioral changes. So first thing, check is whether there is any infection going on anywhere or not.
Okay, interesting. So,
yes. Very common.
So you are doing clinical trials, and I want to get into those. I know that you're doing about 12 different ones right now.
Yes.
5, I think you mentioned, are specific towards Alzheimer's.
Right.
So can you tell us about those?
So one trial we are doing is from Biogen. If somebody heard the news, one of their medicine was recently found to be better, or you can say had a positive results from a trial. So we are doing this trial, and this, if people who know what is Alzheimer's, they can go on the YouTube and search and read more what is the pathology. And as we were discussing before, neurofibrillary tangles. So there is a protein in the brain called as tau protein, T-A-U, tau protein. Okay. So that forms the neurofibrillary tangles. So this medicine is being given intravenously every month and supposed to clear that tau protein.
Really?
So what we are looking is, we are looking somebody even who has not been diagnosed. So the only condition should be progressive memory impairment from the last 6 months. Okay. So they can call us, we can screen them, even they think that their memory is fine, but they still have forgetful moments, we can still screen them. We have to do first 4 memory testings, different, and they have to qualify for each one. So there is a scoring for each one. Okay. Even mini mental state examination we were testing, even normal, 30 out of 30, they can still qualify.
Really?
Yes. So, because they are forgetful, so they might be in a MCI stage, okay, and not a Alzheimer yet. Okay. And moreover, mini mental is very much depending on the education. So because we have to do what we call as a serial 7. So somebody who has not gone to school will easily fail that. So we do 4 memory testings, and if they qualify from those, then we do their blood workup and ECG on the same day, no cost to them. As soon as we have blood workup ECG back, they go and get an MRI. Okay, the MRI to make sure as we were discussing, no vascular dementia, no frontal lobe dementia, no tumor sitting. And mostly in Alzheimer's disease, the MRI will show what we call as a volume loss or atrophy of the brain. So that's the only thing it will show. So the MRI is done, then they go for this special scan called as amyloid scan. And that is nowadays, we were discussing diagnostic of Alzheimer. So they get the amyloid scan. If the scan come back negative, that means their problem is not Alzheimer's, so they don't go further. If the scan come back positive, then they go and get a tau scan, and they come back, we do more detailed memory testing, and they start getting the medicine. So every 6 months, they come. So they get the medicine every month, intravenous medicine. When we give them information, it has all the side effects mentioned in there. Most common, one is headache. Because they can have some headache with the medicine. So they get the medicine every month. Every 6 months, they get the detailed testing. Every year, they get the amyloid scan and tau scan. So main tau scan is to see if they are decreasing the tau proteins in the brain or not. At the same time, with the memory testing, we are clinically seeing how they are doing. So this is 18 months long trial. So they get the medicine every month. Yes. And again, more than 3/4 chance that they will be on medicine, only 1/4 chance that they could be on placebo. So all these trials are placebo controlled. Means they compare with somebody not getting medicine with somebody who's getting medicine. So, but they can, the good point is they can keep on taking, if they have already been diagnosed, to keep on taking the medicine they are. Any Alzheimer medicine they're taking, Namzaric, Namenda, they stay on them. We don't take them off.
That was one question I was going to ask is, what do you do if they've already been diagnosed and you've got existing medication? So you leave them on what they've got?
We leave them on, but they still need to get that amyloid scan to confirm the diagnosis. As we were discussing before, many patients who are being treated as Alzheimer are not confirmed Alzheimer by the scan. They 30%. So they have to have a positive scan. If somebody already by any chance, as we were discussing that IDS trial, there were other neurologists in the town who were also participating. And let's say they have a negative scan, they can come, we can do a spinal tap and not an amyloid scan. And if spinal tap shows that they have abnormality, they can still go in the trial.
So that's one of them.
That's one for mild or early disease. Then we have one for moderate disease where it says this new medicine is being added to their present medication for 6 months and see if they maintain their memory. So this, so far, it may close pretty soon, maybe within a month. The patient has to be on Namenda and Aricept combination or Namzaric. So they get a third medicine added with 2 doses, 50 and 100, and then placebo. And we check their memories for 6 months and see if they maintain the memory. Now the third trial is again intravenous medicine being given every 2 weeks, and want to see, this is for advanced Alzheimer. And they have to be like only on Aricept or donepezil. So any other medicine is refused. The reason being is they want a similarity in the patients. So let's say somebody they are spending so much money, they want the same patients to go and tell the FDA the data. So this medicine is every 2 weeks intravenous and for 12 weeks. Now only in the first trial, mild trial, Biogen trial, they will get the scan. No other trials are involved with the scan. So just want to let you, because these patients are already diagnosed, or they want a diagnosed patient. They don't care about the scan, because these are already moderate advanced patients, and medicines are being given to maintain the memory, not a preventative. Whereas the first one is to prevent or slow down significantly the progression. So this is third one. Then we are doing another trial, as you know, and just for information, my mother was also diagnosed with Alzheimer's from the scan. And nowadays she's advanced that the morning starts with yelling on a caregiver, yelling on anybody, hitting. So many times people get agitated, mean, yelling. So we have a trial for that. There is no medicine so far approved for agitation. The only thing we use is antipsychotics. Seroquel, Abilify, but they have a risk of falling.
Yeah.
So all those have a,
Yeah.
and you will get a warning from the pharmacist, and you will get a warning from the insurance company that there is increased risk of fall with these medicines. So this trial is to look for a medicine for agitation, behavior issues.
Okay.
And the last one, as you know, you might have seen and know in the care homes, hallucinations. Many
Yeah.
times these people will have hallucinations, or somebody standing there, bird is standing there, or they will keep on talking to the dead people already there. So this trial is for hallucinations. This medicine is already approved for hallucinations and Parkinson's.
Already approved.
Yes, and
Okay.
available. So they are looking, will this help in hallucination and Alzheimer's?
Really?
Yeah, psychosis. We use the word psychotic features like hallucination, delusions, and sometimes these delusions could be very mild, where a person, wife or husband, may have firm belief that they are cheating on them, or they are going to take away their money. So these are delusions, and very commonly seen in Alzheimer patients.
Really? So the one that's for Parkinson's, it's already been approved.
Yes,
Can you share the name of that one?
Nuplazid,
Okay. Really?
Pimsvarine, that's it's called.
Okay.
But again, it's costly medicine. If somebody has to pay, it's like $1,000 a month. Okay, so
yeah.
that's
Yeah.
what they're looking for. Insurance companies usually will not cover for Alzheimer if you write Alzheimer diagnosis.
Really?
Yeah,
Okay. Really?
they want to see Parkinson word over there.
Yeah. Yeah. Interesting. So these that you've mentioned are still open.
Yes,
Okay. They can call your office. They can get the information. Set a time to come in and talk about it and get the information. I want to talk about.
I want to add only one thing here.
Sure.
With Mary Espinola, we are working to arrange some dinner programs
Yes.
to give information about the trial. So just want to let
Yes.
know whoever is listening can contact Mary, and we
Yeah,
can.
that's Maria Espinola with
Yeah.
the Alzheimer's Foundation of
Yes.
Central California. And just a little plug, by the way, we got a golf tournament for her coming up
Yes.
in a week from this Friday. And so if you want to be a sponsor or play, we'd be glad to chat with you about that. But yeah, the Alzheimer's Foundation is a local group that's doing lots of support groups. Maria Espinola is the director, does a great job. She's trying to get the word out. She introduced us, and she's trying to make sure people understand the value of clinical trials. I mean, quite honestly, other than maybe a potential side effect, there's no downside, is there?
I won't say that. I will be very cautious because you never know what a medicine can do. Okay, but again, at the same time, if you remember, long time ago, there was a medicine called as Vioxx. It was used for arthritis. And we knew from the day one, if you combine these two medicines together, person can go into heart failure and all those issues. So it is mainly the physician need to know what they're prescribing, what it is. Same way, clinical trials, these medicines have gone through phase 1, where a person is given almost 5 to 7 times a medicine to see, and a normal person, see how much medicine need to raise the liver enzyme, does it affect the liver, does it affect the kidneys. So phase 2 trials are where they want to find that dosage, how much dosage is needed. Okay. Phase 3 is where we know the dosage and we want to see the efficacy in a larger number of patients. Okay. And phase 4 is like something post-marketing trial. They want to see more longer. So these medicines are studied. We know most common side effect in percentage basis, but if something comes up rarely, we don't know. Okay. So we know the most 90%, 95%, but something which rarely happens in 1 or 2%, we will see in the trial.
Sure.
So saying that, if somebody says that am I going to be guinea pig? No. We know most common side effects. We know how to handle it. Only thing we are working is to see this dosage or this medicine, how it works in the particular condition. Now, as we were discussing, in the last 10 years, there is no medicine approved for Alzheimer's.
Correct.
Until people come forward, participate in the clinical trial, we may not get a new medicine. So we want volunteers come forward, participate in the trial, and then we can go from there. We just finished, I won't use the word finished, but they finished early, the Lilly trial, which you were talking about 4 years long. And we had about 6 patients on the medicine, and I know about 4 of them going back. Yes, they were definitely on the medicine. They were improving. Okay, but again, it was a placebo-controlled. We don't control that. They were 2 possibly on placebo.
Okay, interesting. So that's one of the things I wanted to talk about. Why do a clinical trial? What are the benefits of that? So they go to your office, they go through a analysis and some tests and whatnot, but this does not cost the patient, right?
No.
So
and we don't bill the insurance.
Correct. So the drug company
They pay.
is paying for that.
Yeah.
So
see, presently, if we are looking for mild patients with this, the criteria is mini mental state more than 22. Okay, like should be 23, 26, whatever. Those are the one who can get the amyloid scan. The other trials will not, because the diagnosis are established and moderate. So these people, if they want to come and participate, they can, diagnosis can be confirmed, they can proceed with the trial and go from there. So one, they get a free care and better care not available.
Sure.
Second, they're closely monitored. They're coming to our office every month to every other month, getting memory testing done. Everything is closely monitored. They have any side effect, they have anything going on. So that's second thing. Third, let's say this medicine finds to be effective. So they are getting almost, I won't say even 1.5 years, they're getting 3 or 4 years before it's approved by FDA, even more longer.
Yeah.
We have been doing an MS trial, and this medicine is not approved yet, close. It's 5 years gone. Companies giving the medicine to people who are participating in the trial, and real medicine, no placebo, and have been so effective that almost no new lesions found in the brain.
Really?
And it's a tablet, yeah.
Wow.
So they come to us every 3 months, we evaluate them, get the next medicine, go home.
So folks, if you caught that, but if it's MS that you're dealing with, they have some.
We have 2 trials going on for MS,
yeah.
yes. Yeah, we have 2 trials
That's
going
amazing.
for MS, one for epilepsy. A few migraine trials are coming up. Recently finished.
So let's talk about that real quick. The migraines. It's almost as a gray area, it seems to me, as maybe dementia, as far as a broad term it's used. People blame a lot of causes on, migraines. They apply a lot of causes to them, but is it that easy?
Migraine is one of the most common pain condition. And again, it does cause a lot of loss of work hours and economy is affected. There are patients who will get 1 or 2 migraines, and there are patients who will have 15 migraines a month. So everybody is different. So once we diagnose, just giving example, recently a new medicine came called as Aimovig. It's injection given once a month. Okay. So we did participate in similar trial with a tablet, and the patients were in the real medicine trial, open label trial for up to a year, and very great results. So they have been not presented to the FDA. They're coming back to again with a more bigger trial and longer trial. So one approved, Aimovig, second one coming out probably another few months. But this is a different type of medicines. Only preventative medicines used to be either anti-epileptic medicines or antidepressants. So now this medicine works a different way.
Really? Wow. That's very promising, actually. Really. Well, we're going to take a final break real quick and just have a short little last session, but we're going to finish up this conversation with Dr. Bhatia with the Neuro-Pain Medical Center. I'll be right back. Hey, we're back with Truth for Seniors, and man, this has just been an amazing show. We're definitely going to have Dr. Bhatia back because this is going to help a lot of people. Want to answer a quick question? I'll let the doctor do that, of course, to a dear friend, Kim, who hits us up on Facebook and says, I'd like to be curious to know if people that take medication long-term could bring on dementia later in life.
The answer to that is certain medications can do that. Can they bring in dementia itself, or can they cause what we call as a pseudo-dementia? So pseudo-dementia is where there is not a real problem in the brain, but it make you forget. Many epilepsy medicines can make you do that. many medicines we use for the pain, opioids, are notorious to make you forget and cause your brain slow down. Okay. Topiramate, one of the medicine used for epilepsy and migraine, notorious for that in higher dose.
Wow.
Anybody who is an old time antipsychotics, Haldol, trihexyphenidyl, old ones, they can cause that. The new ones are much better, but the old ones, somebody is getting them for 20 years, they can get dementia.
Really?
And we have seen that even those people, the brain is shrunken.
Really? So thanks, Cam, for the question. And so one of the things that's just in the last couple minutes here, so people don't want to go into a trial.
Yes.
What you're telling me is a lot of people are dealing with something they want an answer now, but a lot of times we're not maybe going to be able to get the complete answer until you go through the trial to know with certainty what.
Right. Again, if somebody is having hallucinations, and we were discussing, or real agitation, and we ask them to go in the trial, they may not. So I understand them. These trials are all voluntary.
Sure.
They want something to be given to their parent or somebody right now to control the behavior. But if somebody is mild, where it is not being too much bothered, I would ask them, please volunteer for the trials. Agitation, hallucinations. Yeah, they sometimes say 2 or 3 times a week, okay, I see somebody in my room. So even those hallucinations can be controlled. And that's what we are looking for, people who have mild to moderate agitation or hallucinations, not being stressed out to them or stressed out to family, where they need an immediate treatment.
Yeah, wow, I appreciate that.
Yeah.
So, folks, one of the things that my wife and I did years ago when our daughter was diagnosed with cancer, we were asked to be participants in a trial. There was different drugs for chemotherapy at the time. We were told this is going to help find better treatments, and so we participated. Don't know how all that worked out, but I felt good being a part of a group trying to help with the cause. And if you're concerned at all, you know what, just consider this. It's really not all about us, although that might be why you contact the Fine Doctor.
I think it's going to, sorry to interrupt you, it may not help them too much, but it will help their children or somebody younger who may develop it down the road.
Thank you. Very well said. The overall cause is to help others. And so you can go to Neuro-Pain.com. You can call 559-437-9700 and email doctor and get your questions answered and see if it'll help you. I believe that there's great information that's out there, but it's not any good if you don't get it.
You can email us from our website, Neuro-Pain.com.
Okay. Thank you. Appreciate your time.
Thank you.
Appreciate what you're doing to help people and with these trials. And I know that this won't be the last time that you'll be a guest on Truth for Seniors. So
thank you.
Y'all have a good day. We'll see you next week.